Good evening, everyone, and welcome to the informational session for the Board of Pensions. My name is Mike Kremnitzer. I'm the Director of Benefits and HR for the conference, and it's going to be my pleasure to be your host as we go throughout some presentation and we learn a little bit more about the recommendation number 3 from the Board of Pensions. I want to thank you for joining us, taking time out of your schedule, maybe interrupting your dinner tonight. So thanks for joining us. And my hope is that by the time that we're finished, that you have a really good understanding of the legislation that's before you and have a good opportunity to ask and have answered the questions that you might have. With me are a few folks that I'd like to introduce, as you might be hearing from them from time to time. First is Anna Giozzi, and I know many of you know Anna. She is the chair of the Board of Pensions. And then we have Bill Brownson. Bill is my boss, my supervisor, and he is the CFO and Director of Administration. It's good to see Bill. And we also have a special guest, Kelly Wittig, and Kelly is the Westpath Director of Health and Wellbeing for the benefit plans. And I thank Kelly for joining us. Before we dive into the material, I'd like to help frame our conversation so we can be good stewards of our time together. If you've studied the recommendation, you know that it's a complex and comprehensive document. It's a common theme at the conference that we love a good acronym, and the recommendation has just a few. The good news is the vast majority of the legislation that's going to be before you has been approved each annual conference for years. Pension, disability, active health insurance, and billing for those benefits hasn't changed. Annuity rates for surviving spouses, moving reimbursement for retirees, and EAP eligibility also hasn't changed. For these items and many, many more, this year represents a roll forward. However, we do have a couple new pieces of legislation that I'd like to emphasize. First, we're moving retiree healthcare from the current Humana Medicare Advantage group plan to an individual health reimbursement account, or HRA. That HRA is administered by VIA Benefits. The second piece of legislation is a 2% increase in the past service rate, or what we call the PSR, for pre-82 years of service. So let's start with the retiree healthcare transition, as it has a broader impact, and you probably have more questions on the HRA transition as opposed to the past service rate increase. To help those who might not have much experience with retiree HRAs, or maybe just HRAs in general, I've asked Kelly Wittig to give us an overview of what it is, how it works, and maybe some of the advantages that it'll offer our retirees. Kelly, the virtual podium is yours.
Thank you, Mike. And thanks in advance, everybody, for taking some time to listen today. I wanted to let you know that I'm happy to answer questions during midstream. You can interrupt me if you'd like, and I promise it won't throw me off. But like Anna said, you can also enter questions in the chat, and we're happy to take them there as well. So Tim, I think you're advancing slides for me, so let's go ahead and get started. So as Mike shared, the proposal is to replace the West Ohio Conference's current Humana plan with the program through VIA Benefits. And VIA Benefits is a Willis Towers Watson product, so you may be familiar with that consulting firm. We've actually partnered with VIA Benefits at Westpath since 2012. They were called Extend Health then, and they've also changed their name to One Exchange in the middle, and now they are VIA Benefits, and we hope they keep that name for a long time. And what VIA Benefits does is they offer access for retirees and their spouses to thousands of individual Medicare supplement and Medicare Advantage plans. And then, as Mike said, they give you a health reimbursement account, or you have a health reimbursement account that helps you pay for those individual plan premiums. So that's what we'll be talking about today. Next slide, please. So as I mentioned, Westpath has been partnering with VIA Benefits since 2012, so almost a decade now. They were and still are the largest Medicare exchange provider in the industry, and they really have a huge selection of different health plans for folks to choose from. Another thing we really like about them is they have what they call senior sensitive licensed benefit advisors. So the individuals who guide you through selecting a plan are not only licensed to do so and educated in doing so, but they recognize that they're dealing with a population who may never have had to choose their own plan before. And so they have a little bit of a higher level of service and support for the population as we're transitioning and then ongoing to continue to meet your needs. The health reimbursement account allows the conference to give you money to pay for premiums without you having to pay taxes on that money, which is always a good thing. And then Via Benefits has just a history of robust communications to retirees. So whether that's outreach via phone, paper information that comes in the mail, or web platforms, they just do a really good job of explaining what can be a very complicated topic. If we go to the next slide, you'll see that through WestPath, we've actually transitioned 32 plan sponsors to Via Benefits over the last decade. And about 4 of those are non-conference plan sponsors, but the other 28 are other annual conferences. So you guys are in excellent company by making this transition. By no means are you kind of going the unpaved trail. This is a well-paved trail in the United Methodist Church. What I love to share is that of the almost 10,000 participants, so a little over 9,000 participants and spouses who we've transitioned, they have chosen over 1,000 different plans across over 100 different carriers. And my reason for sharing that is to say that there's no way that West Ohio could offer that variety of plans to meet the individual needs of each one of its members. Currently, you have one plan. So what Via Benefits offers is an incredible amount of choice so that you can have the coverage that makes the most sense for you and your family. And really, if I move on to the next slide, that's what we want to highlight as really why we've seen so many annual conferences go this way before you. So on the left side of the screen, the choice and flexibility is really the benefit to the individual retiree and their spouse, right? So you have choice and flexibility to choose a plan that makes the most sense for you and your family, which may mean, people have different healthcare needs, people have different financial needs, and so that's why that choice and flexibility is important. But what it also does for your annual conference is it allows a more cost-effective and sustainable way to continue to provide the retiree health benefit over time. And that's why a lot of annual conferences have been very interested in this, is that it helps them keep costs more stable for the conference and more affordable for the conference. If you're familiar with exchange, like the public marketplace, the Affordable Care Act exchange, I want to share that retiree medical exchanges, so Medicare exchanges, are very different than that, in part because of just the way that Medicare works. And we'll talk a little bit more about that. So if we go on to the next slide, this just briefly highlights kind of the variety of carrier relationships. And you see Humana on there, and you may be familiar with some of those other names. There are medical, like Medicare supplement plans, Medicare Advantage plans, as well as dental and vision plans, as well as Part D prescription drug plans. So there's really a variety of different providers to choose from. And the reason that this works, if we go on to the next slide, is because Medicare really dictates exactly what type of plans these carriers are allowed to provide. And so the only way that they can compete is based on price. And that really drives the price to the lowest possible, like the lowest common denominator. The other thing that makes this work is that the Medicare risk pool is growing. More and more people are retiring and turning 65 each day. And so that pool just continues to grow and grow. And then because of the Medicare rules, you're allowed to have guaranteed issue when you first lose coverage, either from a group plan, so if your employer terminates their plan, like West Ohio is proposing doing, or when you retire and first become eligible for Medicare, you're guaranteed to be issued a policy. So regardless of what pre-existing conditions you may have, you're guaranteed to have a policy, and you're not going to pay more during that guaranteed issue period. So it works well. Like I said, it's an entirely different animal than the active marketplace, and it has worked very well for folks in the UMC. If we go with the next slide, it just again want to reiterate that the reason that the UMC is headed this direction is just for those two reasons: to control costs for the conference, as a bonus, potentially reducing some of the administrative burden for the conference as well, but also to meet individual participant needs and allow participants to choose the plan that works best for them. And participant and spouse can even choose different plans. And so if it doesn't make the most sense for the two members of the household to be in the same plan, they absolutely don't have to be. So next slide allows me to tell you a little bit more about how this works. So what happens in the beginning during a transition, and this either happens during the transition or when somebody retires for the first time. And then the same is the case if anybody ever decides they want to change plans. So the individual chooses a plan, and they don't have to do that alone. They have support from the VIA Benefits advisor to do that, extensive support. And then what the individual will do is they will pay that carrier the premium directly. It's an individual policy. And so that's a little bit different than what you have today. So if you choose a Humana policy, you write the check to Humana, or you set up the debit to Humana. What's nice is that VIA Benefits is able to help you set up an auto pay option. So if you don't want to worry about remembering to write that check each month, somebody doesn't have to do that. You can set up an auto pay option. And then the retiree or spouse submits that receipt basically for paying the premium to VIA Benefits, and VIA Benefits will reimburse them for that premium with their HRA funds up to the amount that's in the HRA. Another bonus though is that VIA Benefits can set up an auto reimbursement process as well. So it can make a really nice cycle once you get it set up. It takes maybe 1 or 2 billing periods to get it set up perfectly, but then it can really just be on autopilot. And then as long as you want to stay in the plan, the premiums automatically being deducted, and then the reimbursements automatically going right back to that account. And then the individual would just take that card and take that Medicare card and the supplement card and take it to the physician or the hospital, present the card, pay the provider directly for their portion. And then if you have more money left in your HRA, you can also submit those out-of-pocket expenses to the HRA for reimbursement as well. And the HRA funds are contributed by the West Ohio Conference based on their rules for eligibility and years of service. Go on to the next slide for me. I want to talk a little bit more about that enrollment experience and how somebody chooses that plan for the first time. So first, what an individual needs to do is figure out what it is that they need. And the nice thing is that VIA Benefits doesn't require them to do that on their own. So there are web tools as well as paper tools, as well as a phone call to help individuals to figure out what doctors they're seeing, what prescriptions they're taking, what are their financial needs. And then the VIA Benefits advisor is able to really make a good recommendation on the best possible plans for that individual. And that discussion is in a phone call that can be long. If you know what you want and you know exactly what you need, maybe you can finish it up in 45 minutes. But if you need 3 hours to talk with a benefit advisor, they will be there. There is no rush to get you off the phone. And participant and spouse each get to go through this process separately. So once an individual selects their plan, the VIA Benefits advisor transfers them to an enrollment specialist, and then that enrollment specialist basically fills out the application on the retiree's behalf. So they don't even have to worry about that. They submit the application and they pay attention to how it gets approved or if additional information is needed. So it's really a lot of hand-holding through the process to make it as easy as possible. Next slide, please. Just a little bit more about the telephone support. So we want to make sure that you know that the benefit advisors, they are all situated in the United States. They are objective, and the reason that we believe that to be the case is that they are compensated the same regardless of what plans they recommend. So you don't have to worry. Some insurance agents can be biased because they'll get a portion or a commission from an insurance company. And while VIA Benefits overall gets commission by enrolling people in plans, the benefit advisors do not. They are paid in a way that is neutral of what plan they select. So you can feel like they're giving honest advice about really what makes the most sense. And because we've been partnering with VIA Benefits for so long, we actually do cultural training and we talk to them about the United Methodist Church and about the service that our clergy provide to the United Methodist Church, so that they have hopefully a really good sense of who they're helping. And if you want to go on to the next slide, I just thought I'd share this, this feedback that we'd gotten very recently, actually, from a retiree in the Mountain Sky Conference. This individual felt like it was easy to work with VIA Benefits, felt like they were able to save a lot of time because VIA Benefits helped them figure out the doctor and make sure that the prescriptions were included in the plan. So they felt very comfortable making the decision. The individual described them as competent and really appreciated the efforts. So this is not rare. We get a lot of very positive feedback from our participants. And I'm not going to say that we never have anybody who has a negative experience, but what I want to share is that there are so many layers of support between VIA Benefits wanting to do an excellent job for the United Methodist Church, having WestPath there to make sure that VIA Benefits does a good job for the United Methodist Church, and then having West Ohio there to make sure that WestPath makes sure VIA Benefits does a great job. So there are tons of layers of support to make sure that every retiree gets their needs met. You want to go on to the next slide for me. You know, I do want to point out, like, I recognize that this can be a little bit of an overwhelming change, particularly for retirees who haven't had to choose plans before, who haven't had to pay premiums directly. And so I want to acknowledge that it can feel daunting. What I want to point out is specifically the steps that the retiree does have to take, which is to choose the plan and make sure that they pay the premiums, and then to ask for reimbursement. The great news is that VIA Benefits helps with all of those. They help the retiree select the plan. They can set up the auto payment for the premiums, and they can set up the auto reimbursement. And if ever a retiree has a problem with their plan or a question about how their plan works, they're there for ongoing support as well. So yes, there are additional requirements that our retirees aren't used to, but there is support there to help them along the way. What VIA Benefits will do, if you look at that lower purpley box, they will individually call retirees to try to set up appointments to make sure that everybody gets an appointment and looks at the different plans. As Mike pointed out, they administer the HRA, and so that they'll actually do the reimbursement payments. And then in the fall, they will also do informational sessions, like more in-depth informational sessions for the people who are specifically transitioning, either immediately or perhaps retiring in the next. What the conference will do is they will set the rules as far as who gets a health reimbursement account and how much they get. And then the conference will fund those health reimbursement accounts. The conference will also send information about who is eligible to WestPath so that we can get that information over to VIA Benefits and they have all the information they need. And then the conference will help coordinate those sessions in the fall for retirees to make sure that everybody gets the information that they need before they have to make a decision. And then what we do over at WestPath is really just kind of facilitate and provide an additional layer of support. We take advantage of the fact that we've done this 32 times, and hopefully that makes the job of the folks at West Ohio a little bit easier in making this transition. And like I said before, it's an extra layer of support. So if you ever have, if somebody ever has an issue, we're able to intervene on their behalf. So the next steps, if we go to the next slide, just to get an idea of if everything is approved at annual conference, kind of how the next several months will go. So earlier this year, we spent time with your Board of Pensions doing modeling and talking to them about VIA Benefits. And today, of course, we're talking about this as a pre-conference educational meeting. And in June, you guys will in June, you will hopefully approve this proposal and move it forward. And that means in August and September, we'll set up those workshops. And they're typically used to be in person. I'm hoping they can be in person. But of course, last year we did them virtually. So regardless of what the restrictions are, hopefully less at that time, we will find a way to educate and inform the individuals who need to be. one of the questions that came up on Monday is, if we do in-person workshops, will there be a way for people who can't be there in person? And the answer to that is yes. We've always done a recorded version that folks can access online and watch through it or listen through it. So there will be a way to listen whether you can attend in person or not. And then beginning in September, Via Benefits will start reaching out to individuals and schedule them for appointments. And those appointments for advising start usually the second week in October. And they go through the end of the year so that that people have several months to make a choice, and hopefully they don't take that long. They also have a no retiree left behind policy. What we do is we carefully look at the list of retirees, and when we get toward the end, they start sending certified letters and telling the conference, hey, we haven't been able to connect with these people, because the goal is for everybody to have had an opportunity to enroll or say no thank you, so that nobody feels like they were just kind of lost in the shuffle. And the next slide, please. And this is my last slide. I just wanted to share again that the philosophy of WestPath is to care for those who serve the church. And I know that West Ohio Conference has a similar philosophy when it comes to caring for their clergy and lay workers. And so I just want to assure you that even if this seems a little confusing or scary, or you're not sure what to expect, that you have the conference, you have WestPath, and you have Via Benefits, all committed to making sure that this is a successful transition and that every individual retiree gets the care and the help that they need to make a decision that works for them for next. So, I'm happy to answer any questions. I should look and see if there.
Yep. Kelly, you do have a question in the chat.
All right.
You might remind folks about the difference between how reimbursement works for premiums once it's set up, how it works for any other expenses, and what happens if they don't use what's accumulated in the HRA account in a given year.
Yep, definitely. So yes, reimbursement means that you have to pay first, but I shared that you can set up an auto payment and an auto reimbursement for the premium portion. So when you pay the premium each month, you can automatically pay that and then have it automatically reimburse you back in a checking account or however you like to be reimbursed. So that, yes, there's an out-of-pocket expense, but as long as you're getting reimbursed regularly, hopefully, you're never out of that money for too long. And then if there's money left over, you can also submit claims for your out-of-pocket expenses. So co-payments, co-insurance, the portion that you pay for Medicare Part B, you can have that reimbursed. And if there's money left over at the end of the year, you can roll it to the next year. Participant and spouse share the same account. And so if you've got one individual in the family who has a lot of expenses and another who doesn't have a lot of expenses, you can sort of figure out as a family how to best take advantage of the HRA contributions. But it is not use it or lose it. The only thing the only time that you truly lose it is when both participant and spouse are no longer living, the money reverts back to the conference. So you can't send it on to your heirs, but as long as participant or spouse are living, you're able to continue to roll it over.
And Kelly, maybe from our earlier call this week, it occurs to me it might really be frustrating to request reimbursement for small dollar amounts. But if you're looking ahead and you have something substantive coming up, dental wise or vision, that you can plan for, you might as well just wait and request the reimbursement for that and get one reimbursement and carry it out more efficiently. So I thought that was an interesting point made.
No, I think that's a great point. And it definitely makes sense. I even do that with my active reimbursement accounts is, I can pay this $15 copay, but when I have major dental work done, you can believe I want to be reimbursed. And so an individual can choose, right? Like if you want that $15 reimbursed, you can have that $15 reimbursed, but you don't have to. I do think that Via Benefits strives to make the reimbursement process as easy as possible. But if kind of going back to that layers of service, if there's ever an issue, I hope that you would let WestPath know or the conference know so that we could provide that feedback and assistance.
Couple more questions. One is about slides. And I don't think there's any reason why these slides can't be made available. I would say that it's important to distinguish this is informational for 2,000 people that vote at annual conference, only one portion of which are actually in the plan, and that those slides and more will be part of the training that takes place for everyone who's eligible or soon to be eligible in the plan starting in June or July. So that would be fine. And then you have the question from Wayne about non-medical expenses. And I think, we saw Humana. So a lot of Advantage plans have some wraparound benefits. Would they also be available based on the plan selected?
I think you could still choose a plan that had, Silver Sneakers is a popular one. And so you could definitely choose a plan that offered Silver Sneakers. I think a Medicare Advantage plan is more likely to have a program like Silver Sneakers because they are invested in keeping your costs down and therefore keeping you healthy. So you could definitely choose a plan that had some wellness offerings, or you could, if you felt like a better fit for you was a Medicare supplement that paid more when you go see the doctor. That's really where you get to have that conversation with the benefit advisor and say, hey, I really love Silver Sneakers, and what plans offer that. We had another question that's just to me, Bill, and it asks if you have to choose a carrier every year or if you have to keep the same carrier, or can you keep the same carrier? And I will say the vast majority of folks stay in the same plan every year. You can change plans during Medicare open enrollment, which is usually like October 15th to December 7th-ish. So you can make that change every year. You are not free from the risk of underwriting if you make changes. And so the benefit advisors know that, and they will encourage you to think more than just your immediate needs, but your potential long-term needs. Of course, there are some people who say, hey, I'm just going to go for it, and I want to buy a cheaper plan for several years, and I'll pocket a bunch of this HRA money, and then I'll buy a more expensive plan when I'm, when I need it. And that's fine too. There are multiple strategies. And you have to, that's the nice thing about the flexibility is it allows you to figure out a path that works for you and your household.
Kelly, similarly, there was a question in the chat about the range of costs of plans available. Could you share a little bit about that?
Yeah, so almost everybody will have access to a $0 Medicare Advantage plan. So you can choose a Medicare Advantage plan that has no premium, and then would just have amounts you pay when you go see the doctor. So that will be for sure a choice. And then they have, maybe more expensive Medicare Advantage plans that are in the single to double digit range per month. So they might be $30 a month or $50 a month. Still a pretty affordable plan. But maybe then if you pay $50 a month, then you pay less out of pocket when you go to the doctor. They also have Medicare supplement plans, which could be in the couple $100 range. I've seen it in kind of the $220 to $260 range. It also depends on your zip code. It does depend, they do increase with age. So there is, that's kind of a ballpark of the range. What I do want to share is when we did the modeling with the Board of Pensions, we looked at the actuaries did the 100 permutations, thousands of permutations of different ages and how much you use healthcare and all the different plans. And the modeling suggested that the vast majority of retirees and spouses could pick a plan that would net them less per year than your current plan. So the vast majority of retirees have the opportunity to actually save money compared to your current plan.
– Not all questions have to be in chat. So take yourself off of mute if you want to put a question to any one of us.
So what will the range of breakdown be in terms of seniority on the HRA, and what are those amounts going to be?
Good question.
Good question, Deb. Thanks. So what we're going to do for 2022, as far as the dollar amount, is exactly what we're doing today under the group plan. So if you retire with 30 or more years of service, you would receive $1,692 for the year, or $141 per month. That's what we currently do. But it's $1,692, and that's per person. And then for years 20 to 29, it would be $864 per year. And again, that's the current subsidy that we have under the group plan.
You might ask, so how does that change every year? That's sort of the logical next question, right? And just like all plans, in fact, even if the Board of Pensions wasn't headed in this direction with HRA, there'd be a question of whether or not we would stay with Humana. There'd be a question of what the plan design would be. There'd be a question of what the premium would be, just like all healthcare. And so every year, the Board of Pension will review the need or the opportunity to raise the reimbursement amounts. And just like we do with past service rates for pre-82 plan, it's expected that there would be some increases in some years for this plan as well. But it would be a year, each one of those decisions that your board makes every single year.
And one of the things that we've seen over the time that we've been with VIA Benefits is that the increases to the individual Medicare supplement plans, the trend is lower than what we see in the group healthcare market. So that's another way that the conference is able to have some sustainability, is that we don't expect the same potential for growth and costs in the individual market as we do in the group market.
Mike, there's a question in the chat, and you kind of answered it already, but try it again so that folks understand what we load into the total cost of the plan we buy, how much is borne by retirees, and how much is borne by the conference.
So,
and that's something, folks, that's on the website, and those of you that are already retired know to get that information at annual renewal time. And so on.
Yeah, so the total plan cost is about $181 per month per person under the Humana group plan. And that includes the medical, the dental, and the vision. And so for those with 30 or more years of service, they're paying $70 per month. And that subsidy of $141 that I was talking about a little bit earlier is what the conference is responsible for. And then 20 to 29 years, the cost is $139 per month per person currently. And the subsidy for that is $72 a month that the conference is bearing.
So I guess the real way to think about it is today, there's a plan and retirees contribute a part of it and the conference contributes a part of it. In the future, a plan will be chosen, and depending on how much it costs, either all of it will be covered by the HRA subsidy, or a portion of it will, based on the nature of the plan that you select. And any that you have left over is available for co-pays or accumulation for planned major expenses.
Bill, I have a question.
Yes, Brooks.
Currently, my spouse, Terry, also clergy. I'm 30 years plus. She's not. She qualified by conference decision to be charged the amount of my 30 years. So she's riding on my years. Mm-hmm. Will that carry over into this arrangement?
I don't think there are any proposed eligibility shifts on associated with this plan. We're still looking at 20 to 30, 30 plus, and current eligibility determinations carrying forward.
So I guess that means no.
Yeah, I think it's no. I probably should have let Mike speak to it.
Yeah, there's been no conversation.
Much more succinct than I am.
There's been no conversation to adjust the years of service for spouses.
And just for the record, Brooks, as you know, clergy couples are face unique challenges throughout their career, everything from housing exclusions to parsonages, and even into retirement. So it's always a special case. And if there's been a mechanism established I would see no reason why it wouldn't continue forward for you.
I would hope that would be the case. It'd be nice to hear that is the outcome.
Yeah.
Thank you.
Somebody asked if it's possible to make personal contributions to an HRA, and the answer to that is no. An HRA is an employer funding vehicle, so it's just the conference that will make contributions to the HRA.
I have a question. If our current administration votes and gets through a bill, Medicare for all, does that affect any of this?
I don't think so. I think that the Medicare for all is more likely to impact the active plan folks who are not currently eligible for Medicare. Of course, if Medicare changes, then the Medicare supplement market will have to change. But I think that as long as the benefits that are being offered to individuals who are 65 and older remain the same, which I don't believe Medicare for all intends to change that, then I think that there should be no impact to this.
Okay, thank you.
That says we have super smart legal people that are not me at WestPath. And so between WestPath and Via Benefits, we would definitely make any necessary adjustments to accommodate legal changes.
Okay, thank you.
Mm-hmm.
I have one more question. If a pastor retires, and what's happening now is pastors that retire also take a church in addition to retiring, do they still get their full retirement, or is there an adjustment?
So that's a special circumstance that is ultimately the decision of the annual conference. There are some risks, and I won't get into the details. There are some risks to continuing to provide a retiree health plan, a retiree HRA to somebody who's actively working, but there are different levels of risk, and different conferences perceive that risk differently. So Mike, we'll put that on the list for things that we want to talk about so the conference can make a decision on it.
And I might add that those risks are likely different based on the percentage appointment. So a small church appointment that's fractional would have them not eligible as an active employee, might have a different interpretation than somebody who retires and stays with the big church full time, as an example.
That makes
But it's
sense.
good question on that. There's a question that Dave asked about contributions. I think it makes sense to distinguish an HRA from an HSA, and when HSA contributions have to stop and what triggers that.
Right. So health savings accounts are vehicles that you can have employer or employee contributions to. And I think you guys have one currently with your active plan. You are no longer eligible to make, you cannot make HSA contributions once you are enrolled in Medicare. You are no longer eligible for those because you are not solely covered by a qualified high deductible health plan. So individuals who are enrolled in Medicare can't make contributions to HSAs any longer.
One other thing I'd like to point out, and Kelly, spoke about choice as being one of the main positive factors in moving to an HRA. And we tend to focus the choice on the medical piece, but there's also choice on the dental and on the vision piece as well, which I think is a wonderful addition. When I used to go out and do our retiree meetings in person, inevitably I'd get the question about, boy, this dental that only covers x-rays and screenings really doesn't do much for us. Is there an alternative? And now the answer is yes. You'll have an alternative. You can use some of those HRA dollars to buy up, if you will, on a better dental plan or a vision plan, which I think is a great benefit.
Great point, Mike.
I want to add a couple of things. That's not to stop any of the remaining questions, but I really want to commend Anna and Mike and the board for continuing to review ways in which we can make good on promises that have been made to our clergy. There's some, a few key pieces, all of which require funding, right? Retiree pension plan, which is in excellent shape, thanks to lots of donors in West Ohio, good administration and investment management by Westpath. So the retiree income piece is good. We have money set aside that we can promise to make good on these contributions to retiree HRA accounts. We've got a significant pool of investments for that. Our active plan has some challenges in its amounts, and we're still working through that. It's healthcare in America is a big challenge, but there's some gaps, and if we can reduce the uncertainty in some other pieces of it, we might be able to fill some gaps, if not with plans, with other kinds of programs for folks who have unique healthcare related expenses confront them. So this is in keeping with, from what I can observe, and there are some people on here, and I know you won't take offense to hearing this, who have been around a really long time. And you've heard the conversations around clergy benefits and pension, and you should feel great about how far we've come and where we are with it. You should feel really good about it. And this is just one more stage in making sure that the promises that have been made can be kept, and that there's some latitude to address some needs that remain unmet. So I would like you to keep that in mind as you go forward.
Any other questions? I'm not seeing anything coming up in the chat.
Mike, might I ask, so this is the second information session. There'll be annual conference, which is June 6th and 7th, I believe. When would you expect that there might be additional information posted or disseminated, or dates for some communication for this audience going out next? Is that something they should look for in July? When would, just to manage expectations?
Yeah, and Kelly, what do you see as the norm? I don't know about July. I was thinking August, but
So the next communication is definitely pending annual conference approval. And so I think that maybe later in July or early August, usually what it is it's a series of communications. Usually the annual conference will send a letter to impacted individuals, or Westpath will, conference sends something, Westpath sends something to kind of grease the skids, and then when the big VIA benefits packet shows up in the mail, they're kind of expecting it. So that's usually the time frame of it. I think we're in great shape to be doing that, and then usually we would schedule the information sessions for kind of the September time frame. And I know that Mike and Anna and the board have asked to get those on the calendar sooner than later, so people can set aside time on their schedules.
I think for me, it'll be important that our communication is, consistent, with the conference and with Westpath. We want to make sure that it's timely. We want to make sure that it's thorough, and it'll be so.
So if we're retiring this year, we're going through the whole enrollment process for the current plan. And then we're going to start this new process right after that, correct?
Correct. That's correct.
Oh, that sounds like so much fun. Thanks.
And I wish there was a way I could change it. I really do.
That was a big sales pitch for the current plan.
You know what, we remember the VIA benefits folks will make the transition as easy as possible. So hopefully you don't have to spend too much mental energy getting to know the current plan, and you can focus your attention on the new one.
That's good. I don't have a lot of mental energy left, so.
I have those days as well.
Well, Deb, I think that's really the big picture is, you'll have a lot of support and people to walk with you, and make it as painless as humanly possible. But there's got to be one retiree class that's going to have to go through it.
If there are If there are personal questions, it depends how urgently you would like your personal questions answered and about what. So if your personal questions are around choosing a plan, then as hard as it will be, you'll want to hold off until you can actually talk to a benefit advisor who knows the different plans that are available to you. If it's about, how much money that you're eligible for, you probably want to direct that to Mike or somebody in the conference office. And if it's a medical specific thing, remember there's no underwriting, you have guaranteed issue. So regardless of what medical conditions you have, your benefit advisor can help you pick a plan that's a good fit for you.
I just like to say through a retirement plan that I have dealt with VIA benefits, and everything you've said is true. VIA has been very, very helpful. They do spend time with you on the phone. I will admit sometimes it's very challenging to try to figure out what plan you want, some of that kind of stuff, but it works.
Thanks, Jane.
You're welcome.
Will the advisors have access to the details of our present plan? Since I'm not going to go through and memorize all the paper on that.
Yeah.
Would it be helpful to know that they can compare apples with apples, even when I'm not very good at making those comparisons?
We do give them your current plan design so that if you were to say, hey, I want exactly what I have today, they could say, well, this is what you have today, and this is something that's exactly like that. But they could either say that's a great idea, or they could say, but we think you could save a lot of money if you did this instead.
Kelly, you have, and Mike, you have a question, I think, coming from Tom Moyer. Tom, go ahead.
Yeah, you've said a lot about the plans being comparable for people with a lot of years of service. What about the ones under 10 years? And also you've talked about the people who are maybe younger coming out better, but the ones of us who are getting older, like in our 80s or what have you, what's the overall? Is it going to look better, or is it going to look worse? Or
I think so. A couple of questions there, and if I miss one of them, hopefully either you or Anna will help me to make sure that I don't. So it's not like the younger people end up better, and the older folks end up worse off. It's really a continuum, and it just my point was just in saying that the Medicare supplement premiums go up as you age. And so, yes, there will be some potential for higher costs compared to the folks who are younger, but that doesn't mean that you can't still find a plan that will make you better off or equal to how you are today. It just might be a different type of plan, or it might be the same type of plan. And that's what the benefit advisor will really be able to do. And I totally forgot the first question because I answered the second.
It was really about eligibility. And I think for about 8 or 9 years now, clergy who retire with under 20 years have not received a subsidy from the conference for that.
And that is unchanged. But I will tell you that we can make sure that those individuals, even though you may not be like outreached by VIA, and I don't know if that's you or not, Tom. So even if that individual might not be outreached by VIA benefits, we can still make those services available in terms of help choosing a plan. So even if there's no HRA involved, VIA benefits can still assist in choosing a plan if that's something someone would like.
Thank you.
Yeah.
Just real quick, I wanted to follow up, Bill. I wanted to follow up on the slides. So we're going to try to get those slides out to you. We're going to try to send it to you. It's a large file, so hopefully it'll go through. If it doesn't, we're going to put it on the website as well. So you should be able to access it at the website.
Mike, I can save it as a PDF and it will be smaller if that would be helpful.
Yeah, that'd be great.
Okay.
And then Tim's going to send it out.
Okay. I'll get it to you guys tonight.
Got another question. What if the recommendation fails to pass? It's a good question. If the recommendation fails to pass, basically what'll happen is we'll have to go back into the renewal mode with our current carrier and with our broker, and have to shop our policies and look at renewal season like we do every year, and see what comes. We may have to change. Well, we may have to change carriers. That would be a real possibility. So it's possible it wouldn't even be Humana, even if we have Humana this year.
I think that's a good point, Mike. The absence of this passing does not mean the absence of change.
Yeah, correct.
There will absolutely be changes, even if it were to continue. I think the downside strategically, if we think about the whole of clergy population, is that by moving to an HRA model, there's flexibility created for the board to look at its resources and think more creatively about how to fill some gaps that we've got, particularly in the active area. And we just are unable to do that with the way in which liabilities are calculated with retiree group health plans today. So I think that's another consideration. I'll say one more thing. There are some people in parts of the country where it's a pain to work with Humana, even though it's a Medicare Advantage, and if your provider takes Medicare, they should accept this. It's a pain. And retirees who are otherwise eligible have opted out. I hope they come back, because this is a way in which no matter where you live, no matter what county you're in or who your series of providers are, you're going to find a plan that your team takes and accepts as in network. And that should mean that really nobody's left behind going forward.
Good question. Any others?
Yeah, Dave Spiker asks a very good question, and about why it's brought to the conference in the first place. And I think that technically it probably doesn't need to be brought to the conference. Technically, your board, Deb Stevens chaired it sometime a few quadrennia ago. Anna's chairing it now. I once served on the board. In West Ohio, the board has retained a fair degree of responsibility to review plans and select them and establish premiums year in and year out. What's been reserved to the conference is who's eligible and how are we going to pay for it. Those have been sort of the things reserved to conference action. So I would say we're doing this in the spirit of A, we know it's a big deal. B, it's transparent. C, we think it's actually a good conversation to have, even if it does raise a lot of questions. So good question, technically not required. I think it's the right thing to do because it's material. The thing about the budget, it has no impact on apportionments. We've got a couple of information sessions coming up on the budget, recommendation number 1, where we'll speak to that. But 2022 will be the second consecutive year in which the Board of Pensions does not make a request for apportionment support to cover clergy benefits. All clergy benefits will be covered through a combination of directly billing churches or clergy, as it were, or from investment earnings on the investment portfolio. So no change in conference budget or apportionment, the part of the budget that apportionment supports.
Bill, I have a question that's unrelated to the retiree health insurance. I did see, I think it's the final item in the recommendation about the posting from Westpath regarding the 2022 comprehensive funding plan. This is just the update that says what position we are in with regard to our pension obligations with Westpath, correct?
Yes, and we should post that, Mike. It's been going on since the 2012 General Conference, and we have certification from Westpath that represents that West Ohio's plans are fully funded, or we have a plan to fund them.
Which they were not when I was chairing the board.
Yeah.
So,
oh yeah,
hallelujah.
Yeah, it was challenging for a bit, and of course the Great Recession also sent shockwaves through the system for a few years as well. Rosemary, you wanted to know, is there a certain amount of participants to make this plan equitable? I mean, Kelly, this is yours, but this is an individual market and there are tens of millions of citizens who participate in retiree plans. And so it is a very robust market and it doesn't require, you shouldn't have to worry about eligibility or being in a pool. You'll find something without problem.
I agree.
Looks like
There's
there's
another question in the chat about eligibility, which Mike and Bill, that's probably for you. Is the 20-year minimum serving in a church or under appointment of the bishop?
So we use years of service towards retirement eligibility as defined in the Book of Discipline to govern our years of service. So what I do is I pull the record straight off of WestPath, and that's the number that we use.
And however, and we talk about serving under appointment, there's a distinction here. It's one thing to serve under the appointment of the bishop in a local church that's been contributing to pension plans. It's quite another to be serving an extension, perhaps not in Ohio, perhaps not in the United States, where benefits have been paid for an entire career by another employer. And so those are handled differently than this. So everyone who's not retired is under the appointment of a bishop in some way, shape, or form. But our eligibility tends to look at appointment in local churches. And if you've got years of service beyond the local church, then Mike gets out the fine print and works through how to navigate that with Anna. There are times for other questions. We don't have to exhaust all of them tonight. You will have more, particularly if you're a retiree or impending retiree. And so this is not your last chance. It's the first of many. And you know how to reach us, I think. Do you have any last words, Mike?
Just real quick, I just wanted to touch on the PSR for pre-82 years of service. So we are going to increase that. That's part of the recommendation to increase that. It's a rounded 2% going from $611 per year of service for pre-82 to $623. The good news, and Bill touched on it a little bit, in our overall funding percentage, we still remain fully funded at 101%. And there is no due amount that we need to send to WestPath to cover that increase. So the 2%, we did not do an increase last year. I think we did the year before. And so that's something that we look at, the board looks at annually each year to see if we can increase the PSR. And that's part of the recommendation this year. Outside of that, Bill, that's the two big changes this year. But as Bill mentioned, if you have any questions, you can reach out to me. I'd be glad to help you. And if you're part of the retiree group, there'll be a lot more information coming down the line. So please be looking for that. We'll take time to get into the weeds for sure. If there isn't anything else, I want to thank you for attending. I really appreciate it. Thanks to my guests, and special thanks to Kelly. Appreciate you taking your time, and we will see everybody shortly, I hope.